Good morning on this chilly day, January 22nd, 2025. My name is Richard Candia. I'm a business manager for Florida Lamarck, a construction company here in Miami-Dade County. And this is South-Dade Shoutout. This is every week, we from the South-Dade Chamber of Commerce, we bring you this opportunity to meet some of our board members, some of our chamber members, where we highlight them. We highlight an event that highlights just how wonderful, diverse, and strong our business community and our overall community is here in South-Dade. And today, our first shout out of the 2025, I'm joined by some wonderful friends. Belkis Alvarez, she is the owner of Hacienda Los Robles, founding member and past president of the, give me a break here, help me out here, Miami Countryside Agritourism Association. And she is the chair of the event that we're going to talk to you about today. Also back for his wonderful perspective is Dr. Charles Augustus, Chief Medical Officer of the Homestead campus of Baptist Hospital. Welcome, guys.
Thank you.
And what are we here to talk about, ma'am?
Today we are here to talk about, and we're very excited to talk about this subject. It is our Health and Wellness Fair being hosted on February 22nd this year from 11 a.m. to 2 p.m. Is that correct? At the Baptist Homestead Hospital.
Yes, and it's one of our signature events. And at the end, we've got a lot of stuff happening here at the chamber this year. Early on in the year, but this is one of our signature events, and one that I'm really excited about. You are the chair. You are our boss for this event. Why did you volunteer for this event? Why is this issue so important to you?
To me, it's very important because it brings our South-Dade community together. And in addition, it provides an incredible opportunity to have healthy members of our community and to let everyone know that they can be healthy, they can be safe, they can feel safe in the hands of medical professionals that are there to assist and take care of them and help them out.
I introduced you as the owner of Hacienda Los Robles, one of our wonderful sites down in the Redlands. And the agritourism group. So your business right now is agritourism, but you have a past in the medical area.
That is correct. For 23 years, I worked as a senior healthcare industry consultant to the trade nationwide. Sat on the State Advisory Council for Medicare for over 10 years and was very involved with our medical providers and patients as well. Mostly medical providers. So for me, this is a subject that hits very close to home, and I'm very passionate about it, and I understand it in ways that others don't. I understand it's important and its value to have that connection between providers and patients.
Do you think that background that you have in a industry that's run the way it is, does it impact the way you run your business today?
Absolutely.
Yeah?
I run the Hacienda like a hospital, I always say.
Oh, my goodness.
It's about safety. It's about infection control. It's about organization, good policies and procedures so that everyone stays safe.
Checklists?
Check.
All right. That's right, Dr. Gus. There's checklists in patient safety.
Absolutely. Safety is the most important.
Dr. Augustus, welcome back. You were here with us last April when you were kind enough to lend us your expertise. Let's get into the highlight of what people are going to be interested to learn about you. You are OBGYN, and you have done what?
I've delivered over 10,000 beautiful babies during my career in Homestead. It's been a labor of love, so to speak.
And the reason the camera is kind to you is because Rachel,
absolutely,
our colleague here, is one of the.
She's one of my beautiful babies.
That's right.
Yes, absolutely.
So give me, with regard to public health, what's changed in the past, let's say, 18 months? What is it that we need to be aware of, and that's going to be highlighted at the fair?
Yes, we need to understand the patient is really involved in their own healthcare decisions, along with the health care provider, meaning that it's a partnership. Patients are very informed. They want to know what are they getting when they're getting a procedure done. They want to know all the details involved in their healthcare, and they should know because they're an educated consumer.
Mm-hmm. Well, how about something a little more that we can relate to? For example, was this past cold season particularly hard? I mean, it was hard on me. I don't know. Is there something that we're going to learn about?
Absolutely. This has been a really tough flu season. We've had an increase in admissions through not only Homestead Hospital, throughout the whole system. And we also have cautioned people, about, hand washing, all the basic things that we talked to them about in COVID. We wanted them to reinstate those things, coughing etiquette, hand washing, all these things help prevent the passage of the viral illnesses.
One of the things that I've overheard in some of the conversations that Belkis has had with our group as they were putting together the event is the education aspect of it. So we've had conversations. Talk to me about the education for the consumer, for the patient.
Yes. In any type of fair, we want to accomplish several things, several goals. One, we want to inform our community about the healthcare screenings that can be provided for them. We want to inform them about free healthcare resources, and we want to educate them about their healthcare options, as we talked about. And then lastly, we want to make sure that we teach them about healthy lifestyles and how that is so beneficial to them long term.
Yeah, and healthy lifestyles, that's a hard one. One of the things we were talking about earlier, Belkis, was from your perspective, the education to the healthcare professional. What should a healthcare professional be looking to learn from this health wellness fair?
They need to understand, as Dr. Augustus was saying, that we're dealing with a more educated patient that is more familiar with terminology that is involved in the healthcare industry, and that they want to be a part of their healthcare treatment as well. So I think that having the providers the opportunity to be close and personal with these patients, not necessarily in their treatment room, will allow them to better understand them, their culture, their background, and make their healthcare service accessible to each member of the community.
The word fair kind of connotes fun.
It does.
But we have a lot of important providers that are going to be participating and giving good information. So for either one of you, I'm throwing this out there for either one of you, why should the members of our chamber, the business members of our chamber, why should they consider taking advantage of this fair? Either one of you.
Well, I'll start. Okay. So it's very important that our members, who are our lifeline at the South-Dade Chamber, be very involved in this, and that they reach out to their business clients and to their friends and to their family and be involved. It's about being involved. It's about caring. It's a very important thing as a community when you come together as one and you make a difference. Then the community becomes healthy as well, creating so many different diverse opportunities in life that you can only do when you're healthy.
Yeah, and Dr. Augustus, same question, but with a particular spin. What about the employers, the business members of the chamber, perhaps sharing this opportunity with their employees, no?
Yes, I think Belkis said something very vital and very important. Community. We're all in this thing together, called South-Dade. We want a healthy community. We want to provide services, and we want people to understand what we have available to them. Like I think that there's some new and innovative things happening in Homestead Hospital. We've gotten 2 new robot apparatuses. One called a Mako robot, used for replacing total joints, and we've got a Da Vinci robot that is used in general surgery, in gynecology, and in urology. So we've got minimally invasive surgery available right there
in South-Dade.
In South-Dade.
Yeah.
You don't have to go anywhere for it.
That just that alone is part of the information we need. So while I have you, I have the camera on you. What is a fair goal that this health fair should aspire to?
And I think the most important thing is inform our community about what's important. One, in maintaining their health. Two, services that are provided in their community, like as we talked about. And finally, being a part of this whole community and helping give back to everyone in the community.
One of the things that we comment a lot at the chamber level, at the board meetings and at our chamber events, is exactly what you were just alluding to. We have the stuff, we have the resources, we have the ability, we have the capacity in South-Dade. There's no need to go scurrying around when you have those needs. Okay, well then, you mentioned community. We mentioned it a couple of times. What's the importance of culture, and the crossroads of culture and all the different cultures that we have in South-Dade? The crossroads of culture with healthcare, and perhaps may I touch specifically on mental health?
Absolutely. So mental health is so important in this moment of time for our entire community because of all of the stresses that we all deal with in different ways. So I have invited a mental health specialist who will be participating and will be available to anyone who wants to come up and speak with him about their concerns, and who will also be offering education on how to identify pointers that could affect your mental health. It's our computer.
And some of our cultures,
Yes.
it's a little harder to
accept.
talk about those
Yes.
issues, no?
Yeah, and to open
recognize.
up. Yeah,
To open up.
you know, I always say this. Mental health is just as important as physical health. And we tend to sweep mental health and how important it is under the rug until things come to surface. But we want to, just like any other, we prevent things from happening in your physical health. We want to prevent things from happening in your mental health. Yeah. And that's why it's important to talk about it, to be upfront and provide services and let the community know how important that is also.
Baptist Health, the Homestead campus, is accustomed to working with people of various cultures, various languages, just because of the nature of where we're at. The importance then of a fair of this type, meeting people where they're at, their language, or maybe being sensitive to cultural differences. I mean, is that something that we aspire to in the fair? You guys have talked about
Absolutely. It's very important to be able to identify with all of the cultures, and we do it with respect, with kindness. Lo hacemos en español también.
Mira vos, mira.
Cuando es necesario. Es muy importante poder conectar, y yo invito a todas las personas de la comunidad del sur de Miami-Dade que vengan a esta feria, aunque no hablen inglés. Tenemos muchas personas que hablan español.
Exactly.
And it's very important, and what I'm saying, translating, is that we invite all members of our different cultures, even if they don't speak English, to please join us. We're there for them. Our invitation out for this health and wellness fair is in English and Spanish and in Creole. And we are going to give it our best shot to be able to communicate in all of these languages with our visitors that day. We want to make it fun, and we want to make it educational, and that they can understand the importance of being there.
Dr. Augustus, that statistic is still mind-blowing. 10,000 people. It fills a whole movie theater and restaurant. It's like all of Perrine, you know.
A stadium.
A stadium. But let's use those folks. Rochelle is here. In the lifespan of those babies that you've delivered, of those people that you've delivered, many of them now adults and working. Thank you, Rochelle. How has the way we talk about healthcare changed? What have you noticed? And don't include yourself, because you're right outside of the curve. You've always been very, very attentive.
Right. Well, I think it's changed by communication. You know, like we stated before, the patient is a partner in the decision making, in all aspects of his or her care. And like we talked about, you have to reach them on a cultural basis. You have to reach them on many levels now, because we have to treat the whole patient, like we said, the physical, the mental, even some cultural biases and differences that we run into. We have to embrace all these things when we come across. So you have to reach people and go forth. If it's culturally, you've got to be able to relate to their culture. If it's from other aspects of life, you have to be able to reach them on those levels in order to be able to communicate and treat them. People will be turned off if you don't reach them on their level. And that's very important. Different before, when I started medicine, I won't say how many more years ago it was, but we'll say a couple of decades ago when I started, you were the doctor, and what you said was holier than thou.
That's it.
That doesn't go anymore. That's you. People are educated themselves. They're consumer educated, and they're doctor educated, and they should be. And that's how it should always be. It should be a team decision about your health.
That's very, very important. And at the fair, we're focusing on fun, and there's going to be the health insurance folks talking about what can and can't be covered, and explaining to people. That's scary. I don't understand my health insurance, so that's always a key for me. But we also are going to have actual services offered to people, correct?
That is correct.
Give me a rundown on that. And I remember Baptist was very active last time.
Yes. Yeah, we're going to have blood pressure screenings. We're going to have glucose screenings. We're going to talk about women's, men, and teen health. We're going to have doc talk. We're going to have an orthopedic surgeon who's going to talk about the latest and modalities in treatment and operations. And we are going to have a GYN doctor. I think Dr. Paredes will be joining us talking about women's health. So it's very exciting to have physicians there and being able to give them information right there in real time.
Yeah, last year the Baptist folks weren't very nice. They told me you're not in very good shape. Basically, you're not in very good shape. It was not. It was very, very unpleasant. I am very proud of our chamber, and particularly this segment, the South-Dade Shoutout. We've featured many mental health providers here in the past, and I know there's going to be more than a few at the event as well. Are there any other service providers that are going to be participating that you want to give a shout out to?
Well, I'll be honest with you, we are still getting them organized, but by the second shout out, Richard, I will definitely have a list with names and last names and company names. But we're very excited. There's many, and it's going to be a well-rounded health fair of all areas of medicine. The
capacity of Homestead Hospital. Let's talk about that a little bit. You mentioned some things that folks may not be aware of. The robotics, the availability of robotics, the Da Vinci, which I know a little bit about. Maybe you can go into some detail. And so orthopedics, it's a young man's need. It's also an older, not so young man's need.
Exactly.
So that's been growing. You guys have been focusing on that, yeah?
Absolutely. We've gotten two very talented orthopedic surgeons in recently. They're sports medicine fellow trained, meaning that they deal with sports injuries along with joint replacements. What that means is we treat the old and the new, meaning that for the older individuals that get seasoned, that get them back on their the pickleball court and other places as quickly as we get the young athlete back on the football field or the basketball court. It's very important. Different phases of your life. As you grow older, we know that life brings other challenges, and so those challenges we have to understand our bodies and make sure that we understand that, you know, as you age, you have to do age appropriate exercise and keep fit as much as you can without hurting yourself. And that's a very important proposition, is to stay healthy without hurting yourself.
We had talked about, Dr. Augustus and I were talking about how just how we apply certain things, and the knowledge that we have has changed over the years. When we were younger people, you'd be out there practicing, and the coaches would tell you, don't drink any water, you're going to get cramps. Here, have salt tablets. And we know now that that's not true. So that's a stark example. Mm-hmm. And is there any other kind of example of perhaps cultural or age defined things that we used to do that we shouldn't do anymore that you can think of?
Well, you mentioned one important, especially in South Florida, hydration. Mm-hmm. That old adage of don't drink, you're going to cramp. Mm-hmm. We know that's gone out the window. Making sure you stay hydrated at all times as you're out doing any of your activities is very, very important. And also to listen to your body. When you get tired, stop, rest. You know, because that's when injuries usually happen, when you're over fatigued, your muscles fill up with lactic acid, and you tend to have tears and ruptures. So you listen to your body and stay hydrated. You know, your body is your best teacher. Listen to it.
Yeah, and that's not always easy. Belkis, I wanted to, before we have a few minutes here, I wanted to go over very, very quickly some of the other activities we have going on in the chamber in the next few weeks. The January 27th, which would be a wonderful opportunity to talk about this event coming up. On the 27th, we have a networking event at the Fairfield Inn in Homestead. On the 13th is the state of South-Dade, another signature event. And then on 22nd of February, Health and Wellness Fair at Baptist Homestead campus. So there's a lot of opportunities for members of the chamber to get involved and to participate. I asked Dr. Augustus what one of the goals should be for an aspiration for the event, and I didn't ask you. You're the chair.
I believe that, in my personal opinion, one of my important goals is to bring the chamber and the community together, and that chamber members reach out to their community of their clients, like I said earlier, mm-hmm. and all be one. The importance of being proactive through your chamber is incredible. It really does bring us together. My personal experience starting as a chamber member was how protected I felt when I had the chamber visit the Hacienda. And what a fun journey it's been, and what an educational journey it's been. The chamber assists business in growing and being stable. When you have growth in your business community, there is financial stability, and there is multiple services that are offered that you don't have to get in your car and be stuck in traffic to go into Miami. It all gets done in South-Dade with very qualified businesses and individuals and professionals. So for me, it's about unity and community, and that everyone feels safe and protected and well served.
I love it. I also, the last thing, and I think Dr. Augustus would agree, for those of us that are lay folks that are not healthcare professionals, I would imagine somebody like Belkis. Well, Belkis has had the experience, but your committee that may have not had anything to do with healthcare, you learn so much. You learn so much that's going to help you and your family, because now there's a way to talk to healthcare professionals. There's a way to listen to your body, those kind of things that you're going to hear directly from the healthcare professionals that you've been dealing with, both doctors and providers that are now going to be at the event. I love having a front row view. Dr. Augustus, some final thoughts, please, as we're about to close up.
Yes, I think that South-Dade is as we know, one of the fastest growing areas in Dade County. It is, to me, one of the most beautiful places to live, to work, and to thrive. And I think that bringing the community together in a health fair, introduce them to Homestead Hospital and all the things that we offer to help the community grow and stay healthy is very important.
Well, thank you very much, both of you. Belkis, we're going to see you in a couple of weeks. Dr. Augustus, it's always a treat. And everyone, thank you for joining us. If you have any questions about building a business in South-Dade, please reach out to the South-Dade Chamber of Commerce. My name is Richard Candia. Belkis, Dr. Augustus, thank you very much. Good night, everybody.
Thank you.
Good night.